Hi everyone.
We thought we should make a video because of course it's always been a while and we've got some great updates for you.
We do. So last we spoke, I know that we were talking about, I think, getting the surgery soon. That didn't happen. I was supposed to get the surgery to remove what's left of my tumor about a month ago. And then I ended up getting sick again, not with my stomach this time. I ended up getting a bad case of bronchitis, and I was coughing up blood and other things, and just sick from my body just being so bombarded with stuff, and I'm immune suppressed from the Remicade treatment that I got at the beginning of January to calm my immune system so that it would stop attacking things, especially my colon. That's why I had the colitis, was because of my treatment, my immunotherapy treatment, turning my immune system onto things that it didn't need to be trying to kill, but it didn't turn it on to the very one thing that we wanted it to kill, and that was the cancer, and that was unfortunate. So we had gotten on the pills, and the pills of course continued to shrink my tumor. The chemo pills, it's a targeted therapy that has shrunk the tumor very quickly,
Which is awesome.
Makes
So
it a lot
grateful for
easier
that.
to have the surgery so that it's a lot less catastrophic for my body to get it out.
But then he just got hit with a sickness and it just totally took him down.
Took me down. It was really disappointing.
Hard.
I had just ordered thousands of dollars worth of aquarium. We're building a new saltwater aquarium.
He's got his big project.
I played the cancer card on my wife and convinced her to let me get an aquarium. And so we got that, and as soon as we got the tank here, I ended up getting sick, and so it kind of took the wind out of our sails for that, and that kind of stopped, and now it's just been sitting there with all this stuff in our living room. Mindy's so patient.
It's fine.
And it's fine, and we'll get it all put together soon enough, but right now it's kind of taken over the front of our house. There's a lot to that, but it stopped that, and it stopped the surgery, more importantly, from happening, because if you have bronchitis and you're bleeding from your bronchial tube and they have to intubate you and other things, it could make that worse and cause more severe problems, cause more infection. And so
he went to a specialist,
went to an ENT, and
been able to get that cleared up.
They put me on the right antibiotics and the right steroids and the right nasal spray to help get that under control. That was about a week and a half ago.
And then the best news is that on Friday you talked with the surgeon,
and so we're having the surgery this coming Thursday. So that's great news. We'll get the rest of it out, and had an interesting conversation with my surgeon about primary versus secondary tumor. That's been a point of conversation of, depending on whether or not it's a primary tumor or a secondary tumor, that kind of depends on how far we have to go with margins outside of the tumor itself, go into margins so that it's clean. It's a little bit confusing. Long story short, at this point, regardless.
Why does that matter?
Yeah, well, it matters because a primary tumor, generally, they don't know this because on secondary tumors, they actually haven't done a lot of research on this. On primary tumors, that's where generally the spreading happens. And the secondary tumor it's believed that there's not the kind of spreading that happens from a secondary tumor. And so they have to get to a lot wider margins. They have to be much more careful with primary tumors because they got to get everything because of the spreading thing. And there's only a handful of cancers that have primary and secondary tumors. Breast cancer, melanoma, skin cancer. It starts on the skin and it spreads somewhere else. And we will never know really whether or not this was a primary secondary tumor. We assume that it's a secondary tumor because it's under the skin and not on the skin. Almost always melanoma primary tumors grow on the skin. And when they don't, it's generally in areas like the eyes or the ears, where they can also find what are called melanocytes. That melanoma cancer can only grow where melanocytes are. Melanocytes are what determine the pigment of your skin. And there's really no melanocytes under your skin in the crotch, in the muscle. There's no melanocytes down there. There could be, but there's just not. It just doesn't happen. And so the assumption is that it's a secondary tumor. My surgeon is very confident, and he's going to go in there and see very clearly that's what I have, and the margins that he's going to have to go to are going to be moderate.
So you asked him what kind of recovery should I expect?
He says, I don't know until we really get in there
Really don't know.
and determine. He has to determine how far he has to go, whether it's primary, secondary, or not. He'll know more of that when it comes in, So, he'll probably have to end up taking about a golf ball size of tissue out, up to a baseball size. The baseball size would be far more recovery time than a golf ball size. So we're hoping on the golf ball size. But he did kind of prepare me that it could be that, but more than likely
He said
it
like
won't
a
be.
couple days to a couple months.
Couple days to a couple months,
depends.
depending on how much muscle has to be taken out, especially for the primary recovery. I may limp for a while. I may limp for 6 months, right? Who knows, because it's muscle that they're having to take out under the skin. That's all. Most of that is muscular tissue, and all that has to grow back, and I have to make sure that I'm stretching properly while it's growing back, but not stretching so much that it re-tears it. So I'm going to have to do some physical therapy.
We'll keep you updated on that.
Yeah, hopefully,
as it
yeah,
comes.
we'll keep you updated on how long that's taking. But I'm thinking that I'll be down in probably at least a week. I'll probably be not doing much for at least a week.
So your job this week is to pray for the surgeon and for everyone involved and for Matt that everything will go well on Friday. We're not sure exactly what time yet, so just pray the whole day.
That's right. And then I'll recover quickly. The fact that my immune system is suppressed doesn't really affect the recovery unless I get like an infection. So I generally recover pretty fast. I'm generally a pretty quick healer when it comes to cuts and bruises and gashes and things like that. So I'm hoping that I grow back that tissue quickly and heal quickly. So that's our hope, and that's our report. And we love you all for your continuing prayers. I always get emotional at this point. I just want you to know that I remind you that we feel them. We feel your prayers, and we're so grateful for continuing prayers from our friends and family. It has been felt continuously throughout this entire process. So please continue that, we ask, because they've made a difference in everything throughout this entire ordeal. So thanks again. We love you.
Bye.